Hello everyone, welcome to video on how to remember or study or understand pharmacology. Most of you guys remember, you think that the pharmacology is a memorization. It is not. There are 7 tips how you can master pharmacology. Before discussing 7 tips, first look into what are the textbooks. The Cadjunk Basic and Clinical Pharmacology, that is a standard textbook, and also we have another big one, the Goodman Gilman, and simple textbook that is Brenner's and Stevens Pharmacology. And if you want multiple choice questions, QBank, that is a Cadjunct's Pharmacology Examination and Board Review, 14th edition, and also there are other QBanks, Lippincott QBank also available. All right, so what are the 7 tips to master pharmacology? Number one, understand pathophysiology, okay, and also understand your physiology, biochemistry, anatomy, microbiology to diagnose the disorder. That's a major key to get the proper medication. That is the first one. All right, know the problem. For example, when you wake up, your car doesn't start. So you have to know what's the problem, whether the tire flat or battery issue, right? So if it is a tire flat, you can change the tire, right? Or if it's a battery problem, you can fix the battery. So that's a major key. Same thing in the medication, you have to know your pathophysiology. For example, in the body, what's going on? You're the rising the pressure or low pressure. If you know the problem, you can treat the condition, right? The diagnosis is important. So take example of antihypertensive agents. So you want to treat hypertension, correct? So you have to know what is the pathophysiology, how your pressure is building, correct? Then only you can know how you can tackle this disorder, correct? So to know about that, so you know what is the pathophysiology. So when you see this picture, so this is the heart and we have the blood vessels, right? So that is a cardiovascular system and it is interconnected with the kidneys. So that is a cardiovascular renal system that regulate your blood pressure. So this the physiology is a fundamental requirement, right? So if you know that one, then if you see what is the problems, maybe there is a vasoconstriction, vascular resistance, vasoconstriction of arteries or vascular constriction of veins, that is the increasing total peripheral resistance that is going to increase the pressure. Number one. Number three, sympathetic stimulation. So your alpha adrenergic or beta adrenergic stimulation that may raise the pressure. Number four, blood volume. So when you increase the volume, that is going to increase blood pressure. When you have stimulation of renin, angiotensin, aldosterone system, that is also going to raise the pressure. Now you know the problem. So now you have to choose the medication that may block or that may decrease this stimulation, right? So when you take the first one to decrease the blood volume, we have medications, diuretics, that is the class. The diuretics class, they enhance the water and electrolyte secretion through the urine, that is diuretics. The medication is the hydrochlorothiazide. You see here what you have to remember, the medication name you have to remember, but everything else, that's a conceptual understanding of the concept, right? It won't come in within a days or within hours, right? So you have to work daily basis to understand the pathophysiology. Then you have to choose the proper medication. Then you never forget. There is no memorization. Only the names, the enzymes, receptors, classes, those are the memorization you need to remember, right? So then what is another problem? There is a vascular resistance. You have to reduce the vascular resistance or to dilate the vessels to decrease the blood pressure. That is another mechanism. So in that we have another class of medication like vasodilators, hydralazine, nitroglycerin. They dilate arteries and veins, reduces blood pressure. And sympathetic stimulation. So how to decrease the sympathetic stimulation? We have medications like alpha blockers, prazosin, beta blockers, metoprolol. And how to reduce renin-angiotensin aldosterone system stimulation? We have medications, angiotensin converting enzyme inhibitors, lisinopril, or angiotensin receptor blockers, sartans, losartan, or renin inhibitor. So we have renin inhibitors. And the next second tip is know the classification. So that is a easy way to move forward to understand the pharmacology. First, know what are the different classes, which are vasodilators, which are beta blockers, which are alpha blockers, which are diuretics, which are the alpha 1 blockers, like that. You know the class, then you can narrow it down to individual medication, right? So the classification based on the mechanism, for example, vasodilators depend because they dilates the vessels, or diuretics, they increases the excretion of urine, reduce the volume, or sympatholytic agents, lysis means blocking. They block the sympathetic adrenergic system by blocking alpha and beta receptors, are based on chemical properties. They classify thiazides. So these are basically diuretics, and also the chemical class also important. Sometimes they may test you on the chemical class, thiazides, loop diuretics, right? So like that, thiazides example like hydrochlorothiazide, sulfonylureas, anti-diabetic medications, beta-lactam antibiotics, penicillins, right? So those are the based on the chemical class. All right, so when you see the textbook, they start with the classification, antihypertensives like diuretics, sympatholytic agents, vasodilate, vasodilators, uh, angiotensin antagonist, renin inhibitors, aliskiren. The third tip, mnemonics. So this is super useful, especially we have thousands of medications and the adverse effects, mechanisms, receptor signaling. If you know the mnemonics, some mnemonics, it will stick forever. For me, I remember some mnemonics for 30 years, right? And these mnemonics are available in the online, or first aid, or sketchy, or you can create your own, how you comfortable to remember the medication, mechanism, adverse effect, contraindication. You can create your own. And for example, here is one example. For example, cytochrome P450 inhibitors, like I create my own like Coke, COKA. What is COKA? So C for cimetidine, O for omeprazole, K for ketoconazole, E for erythromycin macrolide. So these guys inhibit cytochrome P450 enzyme. Tip number 4, suffixes. Those are again super helpful. There are several thousands of medications. For example, 20 medications, they end with one suffix that is the same mechanism, same class. So here is an example. Candacertan is the angiotensin receptor blocker, antihypertensive. There are several sartans, so same mechanism like eprosartan, irbesartan, losartan, olmesartan, telmisartan, valsartan. All the sartans, those are angiotensin receptor blockers. Tip number 5, prototype medication. So each class we have prototype. For example, antihypertensive medication, beta blockers, we have prototype medication, propranolol. So any medication, the suffix is a lol, that is the beta blocker. So lol suffix, lol ending is the beta blocker, like propranolol, atenolol, timolol, bisoprolol, right? So all these lol endings are beta blockers. So all these beta blockers, the similar mechanism of action and pharmacological actions, there are some minor differences. Okay. So beta adrenergic blocker prototype, like NSAIDs, aspirin is a prototype. If you know the prototype medication pharmacology, then it is easy to narrow it down all the different types of beta blocker agents. All right. Tip number 6, retrieval practice. That is the most important. The pharmacology is the highly volatile subject. So you always keep on retrieve how you understand, how you remember, right? So that's the most important. Teach others or teach yourself, vocalize, verbalize, right? So you have to pronounce the names of medications because they are similar sounds. Loratadine, cimetidine, ranitidine, they are similar sounds of medications. You have to spell it out, teach or teach yourself, verbalize, vocalize, discuss. That's the most important. Anki's, you can quiz multiple times, or you can use any other platform to frequent quizzing, verbalize, vocalize, and also curiosity. So that means you always look for labels when you walk into any supermarket and see the over-the-counter medications. What the medication, what is the use, what is the indication, what is the adverse effects, right? Or any of your friend or your family member is using the medication. Ask them how they are experienced, what the experience with that medication, what adverse effects they experience, how long they are taking, what is the dose, right? So these are like real-time applications that will stick to your mind, you can easily remember. Tip number 7, analyze the names. You don't need to be panic about all these medication names. There are many medications, they give the meaning what they are, right? Here is the example, losartan. When you're looking at this name, maybe during the exam, you don't know what is this, right? When you analyze the name, you see AR, that is the angiotensin receptor. Whereas AN, that is the antagonist, angiotensin receptor antagonist. All right. I hope you guys learned something. If you remember all these tips, you can easily understand the pharmacology. I think there are several videos you can watch for the rest of the videos for better understanding. Thank you. I hope you guys learned something. See you next video.